So as I'm sure you're aware, people hear new variant and it really does alarm them. So do we know if this variant is on the rock?
We don't know yet, but we periodically run genomic sequencing. I fully expect that it will be on the rock because we have strong travel links to the UK. This isn't unexpected though. We knew that we were going to experience waves of infection through the year, and at the moment we aren't too concerned.
Mm-hmm. Now, at the moment, you're not actually recording cases outside of those collected at the hospital, and you're not actively testing for variants either. So what would the threshold be for keeping a closer eye on cases? What would sort of make you want to start doing those things again?
Well, it would either be we start seeing increased hospitalisations as a direct result of COVID, and just to reassure people, we're not seeing that at the moment. Mm-hmm. Or if the World Health Organization signalled to us that they were concerned, then we would have to clearly up our surveillance.
Mm-hmm. Now, I know it is still early days when it comes to this variant, but do we have any sense of whether the vaccine works on this variant or would be effective?
Yes, so this variant that's circulating is still a subvariant of the Omicron. So the vaccine that we've had will work. There is a bit more what we call immune escape with this Eris variant, so we are keeping an eye on that and liaising with the UK in terms of what vaccine they're going to provide us for the autumn booster programme.
Mm-hmm. And a reminder for those watching of the booster programme, you will be bringing that in this autumn. Who is that for?
It's going to be, I've advised the government and the GHA, this should be for over 50-year-olds, those with long-term health conditions, those people who live or have close contact with people with long-term health conditions, people living in long-term residential care and health and social care workers. We also offer seasonal flu children's programme, which is the intranasal vaccine.
And just before we move on to another topic, there has been a slight rise in cases. Do you have any idea what might have caused that?
It's so we knew we were going to have increased cases as we went, and waves of infection as we went through the year. It's as people's immunity wanes. We know that even vaccine or natural immunity wanes over time, so we keep going to get waves of infection. The reassuring news at the moment is we're not seeing hospitalisations resulting from that.
Excellent. Well, what can people do to make sure they're taking the right precautions, especially during summer when people do tend to mix a little bit more?
I think it's being aware of the symptoms. If you develop particularly a sore throat with this variant or symptoms of cough and cold, test yourself. You can still buy test kits over the counter in pharmacies. And if you have a long-term health condition and test positive, please phone 111 for advice because you might be eligible for antiviral medication.
Now, aside from COVID, it does feel like we are getting a lot more bugs this summer. I feel like I hear about people talking about it more. And you mentioned just before we started that it is true, we are seeing more bugs. Why is that? And what types of bugs are we seeing?
It's not unusual for us to see more diarrhoea and vomiting at this time of year, and we are seeing a slight increase in Campylobacter infections. This is typically what we get from food poisoning. What we're advising people is think about how you cook your food, how you store your food. Don't defrost the food too long overnight. Defrost food in the fridge, cook it thoroughly and wash your hands. Food poisoning is preventable if you follow the advice.
Is this something we're seeing more of this summer than previous ones?
A slight increase, but nothing dramatic.
Okay, and just before we go, another issue we're experiencing this summer, the heat. It is very hot this year, and tomorrow could see highs of 37 degrees. It might even be the hottest day of the year so far. So have you seen many cases of, sunstroke, dehydration, sunburn, those types of things this year? And what would your advice be?
Yes, whenever we get a surge in temperatures, all countries see an increase in admissions and sadly an increase in deaths directly resulted from the heat and dehydration. Our advice is be mindful, keep yourself rehydrated and try and keep yourself cool.
Have we seen any severe cases in Gibraltar?
We've probably seen an increase in admissions, typically resulting from dehydration and particularly in the elderly, then resulting in a urinary tract infection. So keeping hydrated is really, really important.